Dear friends, I am a professor of pediatric nephrologist Augustina Jankauskienė from Vilnius University, Lithuania. And I just want to share some short information what the parents should know about children and high blood pressure.
Hypertension, constriction.
Who is at the risk to develop high blood pressure? I'm sure that every parent cares very much about his and her child's health, and sometimes there is a hesitation if a child, being even small one like 5-year-old, can have high blood pressure. Unfortunately, even children can have high blood pressure and be diagnosed with arterial hypertension. And so perhaps what we want every parent to know, who is at the risk to develop high blood pressure. So if your child has been born premature, or was born with a low birth weight, or had spent some time in the neonatal intensive care unit, he is having a higher risk to have a high blood pressure. So then simply what we have to know that the child needs to measure blood pressure even before being 3 years of age. But then after 3 years of age, every child at least once a year has to have his blood pressure measured. But there are some other teenager risk groups, like especially those who are obese or overweight, those who are having diabetes, and of course chronic kidney disease are at much more higher risk to develop hypertension. And I would like to draw special attention to these situations, which could be somehow modified by our introduction in future child's health. So it is about the obesity or being overweight. And this is, of course, the possibility to change lifestyle. This is not an easy thing. It's much more easier perhaps to take a pill, a tablet, instead of changing the lifestyle, which we know just from ourselves. But what you can do, you can, giving by your own example of the introducing healthy lifestyle by advertising physical activity. And it seems that why physical activity? Children usually are physically active, but nowadays with a lot of time spent at the computer, so the hours at the screen time has been very much enlarged, which leads to the sedentary lifestyle. So what we have to, once again, to encourage our children to be physically active, to have some sport activities. And if they are a little bit hesitating about choosing something, perhaps you have to give them some advice and to choose their favorite sport. And it's always has a good impact if you make it not in general suggestions, but specifically for your child. And perhaps you, as a parent, know your child the best, how to do, what to suggest. And of course, besides the physical activity, you have to think what are your eating habits. And not, of course, all children like to eat vegetables, which we often tell, but maybe we can just look oppositely, not maybe to consume so much preserved products which have a high sodium concentration, and as well to have a home free of all these sweet soft drinks, which again children like to use. But always it is your own example which can help your child to have another more healthier lifestyle and to live more qualified life in the future. And at the end, what I want to say that what we have noticed in other studies, that the children with a high blood pressure have some impairment even in neurocognition. So perhaps this is what always we want, that our children would be healthy, smart, and with good reaction and so on. So we once again, by concluding, we have to try to help our children as much as we can. And I advise you to look at the HyperChildNet channel, and you also can subscribe the news, and I think then you could get a lot of really fresh and valuable information you might need. And I wish your children to be healthy.